Yes. So in looking at humans who died of heart attacks, they found narrowing of the blood vessels. And when they cut open the narrowing, they found cholesterol plaques, fatty plaques. And then somebody made the observation, well, you know what? There are certain foods that contain a lot of cholesterol. It makes sense that if I eat the foods, they go in my bloodstream, they cause narrowing in the arteries and these cholesterol plaques. And then there were some studies done with rabbits who were fed cholesterol just to prove it. And sure enough, they were fed cholesterol rich foods and they developed these plaques. And later on, this study and similar studies were critiqued because rabbits are basically, they don't normally eat cholesterol. It's not part of their diet. And when they looked at other animals that ate cholesterol and they fed them extra cholesterol, they didn't develop these plaques, but it started everyone down the path. It was sort of logical. If you eat cholesterol, it goes in your blood vessels. And then fast forward, a gentleman named Ansel Keys from the University of Minnesota, he began doing a study linking saturated fat and along with cholesterol with heart disease. And he looked at several countries around the world, and he published this famous 7 studies paper that showed an association with heart disease based on the dietary amounts of saturated fat they ate, which along the same lines as cholesterol. And that was later critiqued, almost immediately was critiqued, because it was realized that there was data available from about 20 countries, and he only picked 7, which showed a straight line relationship with diet and heart disease. When all 20 countries were considered, there was no straight line relationship. And it was sort of either consciously or unconsciously, the data had been cherry picked. But at that point, he was had a very strong personality, was very eloquent. And about that time, a lot of things happened. President Eisenhower had a heart attack, and Ansel Keys was promoting lowering the amount of fat in our diet. He promoted a low-fat diet for heart disease, and it basically became the standard diet. There was a competing view that high sugar diets cause heart disease, but the person and the evidence for that were sort of stamped out at the time. And there was even some underhanded financial dealings where spokespeople were paid money to write articles that were incorrect about it. But anyway, that's started the low fat diet thing, and that became memorialized in official government recommendations in the food pyramid. And it basically drove the phenomenon where saturated fat and cholesterol were removed from diets. And you can't take fat out of food, it won't taste any good. So you have to replace it with something. You replace it with sugar. And so we started on a path to a high sugar, high carbohydrate junk food pathway. Long answer. A lot of snack sorry.
Wells. No, that was great. No, that was
yeah,
great.
The snack well phenomenon, right? You probably talked about that.
Sold a lot of snack wells. And it's like you mentioned, I just want to be fair, like to the listener, if you've never heard this, I would feel weird if you didn't think any of that was weird, because you do think, I have to explain this all the time. I'm helping a dude, he's about 10 days into his first ketogenic diet. He's lost 5 pounds, he's feeling really good, he's kind of past the flu symptoms. And he's like, I feel so strange about eating this fat. I'm already fat. I don't want to eat more fat because it's going to make me fat. And so you have to explain the pathways. And like, you just think that you eat this thing, it's going to get inside you and start to build up. And that just is not the case of how this works.
Yeah, it's almost counterintuitive. I mean, humans, we all search for simple explanations, easy to remember things. And it makes sense. If I eat fat, I get fat. If I eat carbs, I get skinny, but it's actually the opposite way around. If you want to gain weight, you eat a lot of carbohydrates, and farmers know this. And if you want to lose weight, you lose fat, you eat fat.
Yeah. It is very counterintuitive, but just a few questions can sometimes break down the arguments. Like, why does your body make cholesterol? You don't even have to eat it, and your body will make it.
Exactly.
Why does every cell in your body need it? Why is it that we only get heart attacks in certain areas? It's only in arteries, never in veins. If the same amount of cholesterol traveling through both systems, what's going on there? And you mentioned statins, and there's another person in our space that also is into longevity. He also published a book about longevity that was very much looked forward to this year. And it's great. It's really, really good. Save one thing that just keeps coming up. And it's all about lowering ApoB and lowering LDL cholesterol and using medications, sometimes at very young ages, to do that. It's so hard for me to get on board with that. What do you think about that?
Yeah, I mean, I love Peter Attia. He's a very, very smart guy. I love his work, but we differ on certain things. He just goes off the rails, and that's like, wow, you're such a smart guy. I agree with you on everything else, but certain things, and that's one of them. And heck, I'm sure people who follow me probably don't agree with everything I say either, but I agree with you about that interpretation. Statins, I think they do have an effect on heart attacks, but it's very, very small. As we talk about in the book, the effect is exaggerated by showing the relative risk. In the Lipitor ads, they claim 36% reduction in heart attacks when it's actually only a 1% reduction. But the other problem with statins is the side effects are minimized, and there are a lot of side effects with statins that get underreported and are problematic. And a lot of them we don't even really understand. The problem is statins work by lowering LDL cholesterol. Well, that's their purpose. I personally think they work by lowering inflammation. That 1% risk in heart disease, that improvement is the fact that they have an anti-inflammatory effect. The fact that they lower LDLs, personally, I don't think is a factor. Half the people that come into the emergency room with a heart attack have normal LDLs. And if you look at the risk profile or the hazard ratios for things like LDL, it actually is very, very low as far as a heart attack. There are other things that are orders of magnitude higher, things like metabolic factors like HDL or triglycerides, other factors in heart disease, pollution, stress, LDL. I think LDL gets a lot of attention because it's one of the few things that doctors can actually treat. There aren't a lot of things you can do with a pill in heart disease, and statins is one thing you can do. So everybody prescribes statins.
Interesting. We know that there's a subset of people who go low carbohydrate. This is not everybody. This is a far smaller minority of people who are of a certain body weight, BMI, leanness, or whatever, who have a phenomenon where their LDL cholesterol goes very, very high, their triglycerides stay low, and their HDL, what we call good cholesterol, goes really high. And those two things are good. But the first thing really freaks people out. And learning about this subset, lean mass hyperresponders, you learn about them, and it's very interesting. And then you start to go to conferences and you start to meet some of them and become friends with them. And you're like, wow, I appreciate the seeming kind of risk you're running, by doing this. One of my really good friends, if she eats carbohydrates, her LDL will come down, but then she'll have bipolar symptoms. And
Oh,
so
really?
she's got a really interesting debate to make about, like, do I want to feel bipolar, or do I want to think that LDL is going to give me a heart attack one day? And so it becomes a lot more personal.
Yeah.
But now that problem is in my house. My wife just had a blood draw about 3 months ago. Her LDL cholesterol is about 100 points higher than the range should be according to the range. Her HDL is above 100. Her triglycerides are very low. She's 29. She's really healthy. But now we have this one marker that's through the roof. And so it's now a little bit more personal that we want to get to the bottom of some of these things, for me at least, in this house.
Yeah. I mean, I think it underscores that everybody's different, and everybody, we really need to substratify all these different things. And it may be that, certain types of nutritional as certain types of nutritional and lifestyle recommendations need to be personalized, individualized, and we just need more data to do it. But it's interesting. I know if you've had Chris Palmer on your program, and yeah, he just had I was just talking with him, and he was saying, yeah, he had a person, he's a psychiatrist from Harvard who uses a ketogenic diet, a very low carbohydrate diet for his psychiatric patients. And he had somebody that was hospitalized with schizophrenia, and doesn't work for everybody, but for some of his patients, he found dramatic results. This patient was able to get off all medications, and the voices stopped, and was discharged from the hospital. And he went home, but he basically went to the store and found some foods labeled keto, and he started eating them, and voices came back, and the voices started talking to him, or, it was, or Heather Sanderson is another, she's a protege of Dale Bredesen in the Alzheimer's space. She runs nursing homes for Alzheimer's patients, which are really unusual because unlike almost all other Alzheimer's nursing homes, she sends patients home because they get better with Alzheimer's disease. But I was asking her about, she uses a ketogenic diet on all her Alzheimer's patients. And I go, how do you know that this even works? Why? She goes, well, it doesn't work for everybody, but for some of the patients, it's really dramatic. I have this one man who I can tell when he's in ketosis because he remembers his grandchildren's names and gives them a big hug. And when he goes out of ketosis, because his diet changes, he doesn't even recognize them and just walks out of the room.
Oh my goodness.
It's really remarkable.